While I'm waiting for Dice to join me, I'll just introduce myself. I'm Dominic De Los Reyes. My pronouns are they, them, and he, him. And I'm the program coordinator for a program at Union of Pan Asian Communities called, oh no, Trans Youth Project can't come in. Maybe they can try again. Hello, thanks for joining. So yeah, I work with a communication and outreach services with UPAC, Union of Pan Asian Communities, and it's a nonprofit that serves the Asian American, Native Hawaiian, Pacific Islander communities that are more impacted by the COVID pandemic in San Diego County. Hi, Dice.
Hey, how's it going?
Good to see ya.
You as well.
Me again.
Thanks for joining us.
Yeah. So I was just kind of introducing myself and how the program I work for is we educate about COVID-19 and kind of help disseminate information coming from the county and the CDC. We're funded by Live Well San Diego, and so thriving is a goal here, right? Even throughout a pandemic. So I just wanted to share resources with y'all and be a happy, smiling, supportive, non-binary adult face in your life that you can connect to. I'll add my contact information as well. Feel free to reach out, especially over the holidays if it's rough. But for this time anyway, yeah, maybe we can talk about the holidays and COVID and all the updates and whatever other questions people want to post on here.
Yeah, thank you so much for joining us today. I really appreciate it. I know your time is precious as well. And I'm so excited by the work that you're doing in your current institution. I'm so excited that we have maintained contact because this is super important information for our youth. So I was hoping today we could cover the vaccine updates that you know about. And I would like to talk about some holiday wellness stuff, maybe some mental health stuff for the holidays, because man, it can be a struggle for some of us in our community.
For
So
sure.
let's maybe you could give us a quick recap of what you've heard about vaccines and dissemination. And obviously, like, we still are in the middle of a pandemic and we still need to take precautions and we still are in a lockdown. So we need to wear masks and wash our hands and be super cognizant about who's around us, right?
Yeah, you're basically saying it for me. That's a great summary. Because it's like, yes, the vaccines are out now. At least very recently, San Diego just got its second batch meant for members of the public. So, like, not military, for example. I guess they have a different budget for that and other certain subsectors. But for kind of like general public, the second batch or like dose of vaccine has arrived, which means the people who received the first dose are now going to be able to get their second dose. Because the Pfizer vaccine requires two doses, and it's rolling out. Healthcare workers and people who work in like nursing homes, for example, and elder care and long-term care, they are some of the first in this kind of like prioritization of groups to be eligible for it. Um, and then down the line, it's going to be kind of like people in high risk categories. So, such as folks 65 and older, or with compromised immune systems, or other kind of, they call it comorbidities, things going on that, make it more likely they'll be severely impacted from getting COVID, right?
Right.
And then but for just kind of general public, like adults and youth who are not in other higher priority categories, we can expect to be able to get the vaccine around halfway through next year. And
Hmm.
that's why everyone's still saying, please, like, let's continue to hang in there for the next several months, because how the vaccine is going to help is once enough people get it that there's like 70% or more crowd immunity, basically.
Right.
And the vaccine is just one of the kind of layers of prevention and things that we can do individually and as a society to protect ourselves as much as possible from COVID.
So
So
sadly, doesn't mean that everything's going to go back to normal tomorrow.
yeah, we are so over it, right?
Yeah,
Like, just because we're over it, though, doesn't mean the pandemic's over. You may have seen that meme.
that's
And
right.
it's still something like this timeline is totally not what we're used to. We're used to like things disappearing after 2 weeks or whatever, like in the news, and it's just, it's hard, right? It's like, we're all still adjusting to
Hmm.
how this is changing our lives and requiring us to relate differently to everybody else and our, typical habits and routines. Oh, they did though. So I'm gonna take off my like salary comes from the county hat for a small second, where I heard that the county was actually sued for details about the locations of the outbreaks in San Diego County. And so that was released recently, and it's available online if you look hard enough for it. I'll say for actual locations if
Hmm.
you're interested. But basically, like bars and businesses and restaurants and big box stores are
Hmm.
understandably the culprits. And if you're looking through this list, it doesn't necessarily mean that if you go to these locations now you're automatically going to expose yourself to COVID.
Right.
There's like a lot of other factors that would come into play around that.
Right.
Um, and they're measuring outbreaks as like three or more people getting it from a same like source and location in one time.
Hmm.
Uh, so yeah, I want to keep reminding folks about the county website. It's coronavirus-sd.com. There's a lot of new information about the vaccine right when you first go there on the front page, and that's also where you can find the testing sites. There's some modified schedules of locations through the holidays, but there will still be a number of places open around the county. So everyone is also encouraged to get tested, even if you're not showing symptoms. If you think you may have possibly been exposed to somebody, everyone's encouraged to get tested for COVID just so that
Hmm.
and even and if you were tested in the past, they're saying like if it's been 10 days and you basically have been around people who you're not already living with, just get tested again,
Right.
because it's better than not. Also get a flu shot if you haven't done that yet. And there are a lot of free places around the county where you can get that too. There are websites from the county website that's like, what is it? Like county San Diego gov and then /IZ for like immunization.
Hmm.
Um, I can also share after this more links to stuff, but there's, for example, like guidance on, how to celebrate the holidays in a safer way for the pandemic, and advice on that and for mental health as well. My partner also works at GLSEN, which is an organization that gives resources and support to K through 12 students, especially LGBTQ plus. And they just recently put out a blog post on like tips for coping with holiday stress from there's like a national student council that of high schoolers that assembled this. So I kind of want to read from that too, and we can share the article where it's saying in terms of preparation, just reminding that no matter what family and or friends say, you're loved and worthy of respect. We're still in a pandemic, and in-person gatherings are still high risk for COVID-19 contraction. Oh, we also actually have a curfew right now. and stay-at-home orders. So you're not technically supposed to be outside your home from 10 p.m. to 5 a.m. every day. That's I think originally was going to go till December 21st, but it's still in effect because since the stay-at-home orders have been in place, that means it's like uh, that's set for 3 weeks at a time, and then the county like reevaluates how many ICU or intensive care unit hospital beds are available.
Right.
Right now, it's actually 0%. So like, don't get in a car accident. Like
Right.
seriously, like if anyone needs to go to the hospital, people can't promise you're going to be able to get treatment for
Right.
any reason because beds
Right.
are completely full with COVID patients and the, general public who needs hospitals as
Right.
usual.
Right.
So,
LA
it's,
is the epicenter of the world right now. It's my
yeah,
understanding.
yeah. And
Yikes.
we were grouped into like regions across the county. There's like 5 regions, I think. And so we're part of the region that includes LA, but it's also pretty bad down here because, well, a lot of reasons, right? But our
Because
hospitals
yeah,
are,
because
yeah. So,
Um, okay, yeah, just to be cognizant of time, I do want to talk about the GLSEN article. I think that's a
oh,
great
yeah,
resource to share.
yeah.
And I did
Yes.
want to plug while we're talking about it that we do have a local chapter, GLSEN San Diego, and I happen to sit on the board for that
Oh,
organization.
thank
And we
you.
have a lot of new leadership and a lot of really good energy happening in there. There's a lot of movement, and there's room for young voices.
Wonderful.
Anybody who might be a college student or a mature high school student who feels like they would benefit from having GLSEN San Diego experience on their resume. There are a million ways to get involved with that organization, as little as just showing up for the board meetings and serving as kind of an advisor for us, because we need young people to tell us where to spend our energy.
Absolutely. Oh, thanks. Oh, I'm
Thank you.
excited to share that too on my like personal networks. That's exciting
Thank you.
because
Thank you for sharing.
the youth got to lead the way as well.
That's right. That's right.
Y'all have a lot of influence in how we all end up after this pandemic. And we need you. We need your voice, and you're going to be inheriting this future. So, thank you. Yeah. Um,
So tell
so
me about
it's,
this article.
oh yeah, it's just saying like, even though we need to like physically distance and, things are kind of interrupted in terms of holiday traditions and things people might be doing around this time of year, still, it's really good for mental health to like find other ways to be connected to others,
Yeah.
especially like loved ones and supportive people, even if they're not like in the same, physical vicinity as you. So it like, you know, uh, it like negotiate with adults basically if you need help with virtually connecting in that way. But there's a lot of like apps nowadays and ways people can be digitally connected to each other. You could also like write paper letters and do that thing.
What's
That's
that?
I know, right? Like my old people friends and me uh sometimes mail letters to each other and we'll like put stickers on it or color things, and it's just kind of a fun activity to like reflect on how this last year has been and make plans as well and intentions, and like dream things how you want the world to be once we can do things differently, with the pandemic
I love
resolving,
that.
well,
I
eventually, right? So
I have a lot
yeah,
of youth talking to me about feeling stuck, feeling frustrated right now, feeling isolated right now. A
yeah,
lot of that stuff was already happening for LGBTQ kids, and
yeah,
now it's amped up to 1,000, right? And
yeah,
so I loved what you said about while you're calm, while you're having an okay day, that's a good time to make a list of your folks that you can call or text or whatever when you're having a hard time, or especially to connect with during the holidays, folks that you want to reach out to.
Yeah.
And the visualization thing, it keeps coming up. It keeps coming up because everybody's in this sort of meditative state right now,
Yeah.
myself included. I'm feeling that way. Um, Trying to envision the future, trying to figure out what it's going to look like after this. You know, we've had lots of time to assess
Yeah.
ourselves and the world that we're in. Now what?
Right. What do we want to do? How do we want to like make the best use of our time and our energy and our, connections and our spirit, right? To like be the kind of people we want to be and contribute to building the kind of world we want, right?
That's right.
Like,
That's right.
there's such a great, the way we can look at this is there's so much opportunity now to like redesign how we want to do things. We don't necessarily have to go back to the old ways.
That's right.
Um, yeah, and there's also a lot of things to like be grateful for as well. They're saying, you don't actually need to spend time with anyone you don't want to over the holidays. Right? And so you can practice setting boundaries with people. Practice like nonviolent communication and like read and learn about these things like ways to manage emotions or difficult situations with other people, and yeah, like making lists and plans for yourself, right? Having a kind of set schedule definitely has helped me get through some days where it's like I don't have like the emotional energy necessarily to figure out like all of these nice things, right? So if I'm just looking at a sheet of paper and I'm like, okay, do this and then do this and then do this. And then after that, if it's things like get dressed, eat, hygiene, stuff like that, like I'll end up feeling better. And that kind of gives my brain a break. And then I can get back to that moment of like, feeling positive and reflective and like also just trying to be like forgiving of yourself that this is not like a normal or like health promoting
Right.
like thing we're in right now. And so it's okay to like struggle with that. And
Right.
it's human and it's normal and you're totally not alone. Right.
Totally. Brain
So
fog. I keep hearing
yeah,
people say.
yeah. Just like sitting with difficult feelings as well and kind of like letting moments pass is helpful too.
Those are
And like
great pieces of
yeah,
advice.
color,
Boundaries.
playing with like little activities that have a lot of bright colors too.
Mhm.
That can be nice as well. Yeah.
Animal Crossing.
Yeah, right. Yeah, whatever it is you're
Happy
into.
times. Yeah.
Uh-huh.
Yeah.
Yeah.
Yeah, boundaries keeps coming up too, right? We've got a lot of youth that we work with who are still living at home with mom and dad. And
Yeah.
it sounds really easy on paper to say, oh, just tell someone, oh, I don't like that. But it's not so easy when it's your mom or dad or somebody who has some kind of authority over you. Um,
Right.
it can be really hard, or, it's not, you're not doing anything wrong to someone by saying, I want this, right? And so if you ask for something like, please respect my pronouns, and they fly into a rage, that doesn't mean that their response is acceptable response. It's not an acceptable response.
Right.
What you were
And
asking
it's
for
not
was
your fault that
totally,
they did that.
yeah, exactly.
Yeah.
Exactly. And so during this time, I think it's especially because it's like the holiday time, everybody's sensitive, everybody's kind of raw, everybody's stuck together, being super aware of how you're feeling, what you need, if you need to take a break, if you need to go for a walk, or you need to go take a shower or something to take
Yeah.
care of yourself,
Yeah.
because not everybody is at their normal level where they're able to kind of compensate or offer something to you. Not everybody's got it right now, so we have to do it for ourselves.
That's right. Yeah. Thank you. Even just like, sit in the bathroom to take a
Yeah.
moment for yourself
Yeah.
if you going outside can be very helpful. Vitamin D, they have been saying, not to like make health recommendations, but there's a lot of studies coming out saying there's a connection around, helping with prevention of catching anything. So, you can get that by spending a little time in the sun, or
Absolutely.
taking if that's something that you want to and like to and can do, etc. Talk to your doctor.
That's
But
right.
yeah, just there's a lot of little things that yes. Oh, who knows the
Yes.
song Michael in the bathroom? My partner listens to Broadway songs all the time, and I end up like memorizing them because I hear them in the vicinity, and
Uh-huh.
it's
Oh,
like
that's so
control over
funny.
your environment, right? But I'm like, ooh, Filipino, I see you. Like,
I
people.
love it. I love it. Yeah, the bathroom is critical. When I was working at Mess, there were so many people in the little room where we would just hang out, like between calls. It would just get so stuffy in there. And so I would just sit in my car just for hours and hours and
Yeah,
hours and hours. And
yeah,
it became like really comforting to me. I really
yeah.
liked being there.
Yeah. Oh, speaking of sharing airspace, I also just wanted to like add, try to like have ventilation as much as possible, right? Like open a door, open a window, fans, HEPA filters, air filters, like, as your resources and access like permits, right? But in general, they're saying, even if you have to spend time close to people, or if you're in like a household that has some people with COVID and some don't, there's also resources on the county website for that. But in general, try not to be in stuffy air, right? And if you want to be really nerdy about it, you can get yourself a pretty cheap carbon dioxide monitor. And if it's over 600, it means you need to get some good airflow going.
Mm-hmm. Mm-hmm.
Because like those respiratory droplets that we all put out, that's the vector. That's how the virus travels from person to person. So,
That's right.
like it's good if you're keeping everything clean and cover your cough and sneeze, but at the same time keep in mind that even just breathing in and out, if you're staying in the same vicinity as somebody else, that could be also kind of higher risk. So
That's right.
not to have too many things to like worry and preoccupy about, like do as
There's
I
still
say,
a lot of
do.
misinformation. So I think it's good to say it again, right?
Yeah,
A lot of people still think like, oh, my packages from the mailman are dangerous or whatever, but that's like the lowest level of danger.
yeah, don't worry about that as much as like how close you are to somebody else's mouth,
Yes.
basically.
No making out with
Yeah.
strangers for the time being.
Yeah, sorry. Cuffing season is canceled this year. I learned what that was in East County, wow, East Coast, because of the weather and people like being inside. And so people are like, what's cuffing season? It just means that around this time of year, if you like wanted to find a buddy to like, bundle up with, don't do that unless you're going to be living together. It's kind of like there's an added level of intimacy this year
That's right.
for partners, right? Or
That's right.
date friends, because you need to decide whether or not y'all are going to like be in the same bubble, the COVID
That's
bubble.
right. Keep the circle small.
Yeah. So yeah.
Any other good tips for mental health stuff during the holidays?
Yeah, if you need to, don't like there are crisis and access lines available to you. Even if you just want to talk to someone, you don't need to be in the worst situation in order to access it. So feel free to look those up, and I'll add them to this after we're done. 211 you can call. Also 211sandiego.org, the website version of it has a lot of mental health resources. Also, if you want to look up Live Well San Diego, they do too. There's a lot of free stuff out there for you to make use of. So,
Totally.
you
Trevor
deserve it.
Project.
Yeah, yeah.
Um,
Youth Project.
yes, that's right. Trans Youth Project is growing and growing. Lots of new content on there, and definitely a great resource if you have questions about transitioning or family stuff. If you need gender affirming items, that can hook you up with that.
Yeah.
And just like I need a therapist or I need a person to talk to about stuff at school or whatever, they can hook you up with good folks.
Absolutely. Yeah. You deserve the care that you want and need.
That's right. That's
Yeah.
right.
Priority is taking care of yourself right now. So it's okay.
That's right. What are you doing to take care of you?
Who, me? I mean, my butt on my back. She's being a little brat and keeping me distracted from other horrible things. But I mean, I'm grateful to have a supportive agender spouse. They do exist. And also, I read a lot of articles to help keep me grounded in science and data and like mental health resources as well. I have been handling my medical care like never before. And that's amazing to have a feeling of things being relatively under control. I'm like, whoa, it's actually pretty nice. So it's like I'm kind of focusing like if my body is good, then the rest of me, it'll be a lot easier for me to be good.
For
So
sure. For
yeah,
sure. That's a great place to start. Lots of folks ignore their physical health for whatever reason. There's lots of reasons that that happens. Fear of going to the doctor, money. There's a lot of reasons.
yeah, yeah.
But if we don't take care of ourselves, it's a serious indicator that there's other stuff going on, right? If you're not taking a shower every day, or whatever,
Eating.
yeah,
Yeah.
basic hygiene stuff, you might want to
It
start
makes
asking some questions.
Right. It makes it hard for everything else to, happen or fall into place without those foundational things.
For sure,
So,
for sure.
yeah, much love to y'all. And
Yeah, thank you so much, Dominic.
yeah, I
We'll
look
talk
forward
soon.
to next time. Take care. Happy
Bye,
holidays.
everybody.